From Studio DRC at the Daytona Regional Chamber of Commerce, this is the Crest of the Wave. Hello again, everybody, and welcome to another episode of Crest of the Wave, the Daytona Regional Chamber's podcast for the Daytona Beach business community. My name is Ken Phelps. I'm the Vice President of Resource Development here at the Daytona Regional Chamber, and glad to welcome you into another episode. So May is Mental Health Awareness Month, a very important topic. We're going to focus on how it relates to business in particular, but it's become a societal issue, particularly in the last 5 years. So we're going to dive into that a little bit today, and I'm pleased to welcome our guest this month, Tore Gintoli, who's Vice President of Community Engagement with SMA Healthcare. Tore, thanks for taking some time with us today.
Hey, thank you, Ken, for having me here today. Really appreciate the opportunity.
So as I teed it up, obviously we're in the middle of Mental Health Awareness Month. We'll get this out in time so that people are able to kind of tap into these resources. But it's interesting how it's designated a month, but it's really a year-round topic. It's always a forefront. So as we're getting into this conversation, tell us a little bit about yourself, how you came to be in your role at SMA Healthcare and how you support that organization, how the organization supports the community.
Yeah, absolutely. Thank you. So I've been with the company now for 13 years. Started off as the Director of Operations at the Chet Bell Crisis Center. That's out there on Red John Drive. And the Chet Bell Crisis Center houses our detoxification unit, our crisis stabilization unit, as well as our emergency services unit. So it's open 24/7 to the public for anybody having a mental health or substance use crisis, or both of those. Those often, as you know, go hand in hand. So started off out there 13 years ago as the Director of Operations. After a few years, was promoted into the Facility Administrator role. And then a few years after that, we restructured our company. We had been growing and growing and growing. We now cover a 6-county footprint. And along the way, we had to restructure with the whole level of vice presidents and senior directors. So during that restructuring, I became the Senior Director of Crisis Services. So 13 years at the Crisis Center, and early this year, I transitioned into this role as the Vice President of Community Engagement. So my job now is beyond just legislative advocacy. It really goes into educating our community about these types of illnesses and what services are available and how to connect with those services. So I do trainings for the local universities, for the Sheriff's Center, Volusia County Sheriff's, Flagler Sheriff, CIT trainings, mental health first aid trainings. So it's really about getting the word out about how to recognize signs and symptoms and how to connect people with the care that they need. These are incredibly impactful illnesses, and they occur more often than we realize. 1 in 5 of us over the course of any given year is going to be dealing with a mental illness. 20%. It's a lot of us.
Yeah, that is a large number. Let's talk about the history of the observance of Mental Health Month and why we're building that in. That kind of overcoming the stigma. I think that's one of been the biggest challenges around this topic is to get people to be able to talk about it openly and it not be some sort of black mark on an individual. That it's a component of healthcare. So talk a little bit about the how long has this month kind of been in observance? Where do we stand in helping to overcome the stigma and some of those things?
Yeah, great question. So Mental Health Awareness Month was started back in 1949 by Mental Health America. So it's been around for decades now. Mental Health America established it as a way to remind people that taking care of our mental health is just as important as taking care of our physical health. For stigma, with regards to stigma, you wouldn't use names, disparaging names, to talk about a person who has cancer or high blood pressure, right, or leukemia. Yet, with mental illnesses and substance use disorders, we find that having these illnesses, some people see this as a sign of weakness, that the person is a weak person, or they're broken, or maybe they had bad parents. And stigma isn't something that's, a rare thing. For a long time, we saw this with breast cancer. You wouldn't even talk about breast cancer. It was the shameful thing to talk about, right? So there was a huge push to talk about it. Let's talk about it. Let's be real about it. Let's not be ashamed of this. And what did we see? We saw rates of breast cancer decline. We see people being proactive now with their health care when it comes to detection. So I've seen that same type of pattern with mental health. Now, Ken, we still have a long way to go. We do. There's still a lot of judgment out there. There really is. But as long as we keep talking about it as it truly is, as an illness, right, we'll keep moving the needle in the right direction. And that's a large part of what we do at SMA. It's all about educating the community about what the signs and symptoms are, how these are illnesses like any other illness. They're diagnosable, they're treatable. Recovery is a real thing, it's obtainable, and hey, we can connect you with the care that you need to get there.
I think one of the components of this of stigma is people want to say it's something that you see on TV or you see in a movie or you see in other parts of the country. It's not this doesn't happen in my community, it doesn't happen with my friends or my family, but we're no different than any other community where this might be the case. So can you share a little bit about kind of some of the data that might exist in the Daytona Beach region and across Volusia County or your 6-county footprint in terms of, like how much incidence is there? How many, those kinds of data? What can you tell us about that locally?
Yeah, so unfortunately, the suicide rate here in Volusia County, it's 34% higher than the state average. They base these rates on 100,000 people. The state average is right around 14 out of every 100,000 people every year will complete suicide. Here in Volusia County, it's almost 19. We're at 18.9. To put that in perspective, that's the same incidence rate as heart attacks, right?
Wow. Just
as common as having a heart attack here in Volusia County. For overdoses, we are, 53.9 is our rate, right? It's 66% higher compared to the overall state average. So you have more people dying by fatal overdose than you do heart attacks here in Volusia County. That's how prevalent these problems are.
And I'm going to go a little off script here.
Sure.
I warned Tori ahead of time. This is how my thought processes work. Is there anything that you've been able to find in the data or causes that can explain why this region seems to be more
Why is it higher here? We do have a much larger population than we say that we do. We have a lot of folks who come through who are here on a transient basis, so that really increases our population. There is a lot of drug use in this area. We're not a very affluent county, to be quite honest, right? So not that these problems are problems only for folks who have a lower income. These problems affect everybody across the board. But we do also have those types of struggles, right? A lot of people coming through, a lot of transient individuals coming through, and, we don't have a very big tax base to have some of the support that you do see in other counties throughout Florida. Now, at SMA, we always make the most of every dime we've got. And, as a nonprofit, we turn around and pour all of that back into the community as best as we can. But we're not the most affluent community.
Yeah, I find it's an interesting conversation when you talk about people who they think that really wealthy communities are somehow immune to it.
No.
And oftentimes they have the resources to find them in other ways and have the same kinds of situations. Let's chat a little bit because this was a topic that really had an incredible impact on the business community and probably spiked situations where mental health crises were being born. And it's hard to believe that we're now past the 5-year mark of when this started with the COVID pandemic.
Yeah.
It was probably the first time in a generation or maybe several that we had that type of emergent public health crisis where there was a lot of uncertainty amongst the general population. They didn't know, are they going to get it? You cough once and you're like, oh my gosh, do I have COVID?
Am I done for?
Yeah, so it really created a lot of uncertainty. But the toll on first responders and healthcare providers, in addition to the general public, was significant. Can you share what you've seen in trends in terms of how has it changed since the start of COVID? Have we seen that increase that, as a layperson, I kind of felt like happened?
Yeah, it absolutely had a huge impact on our overall mental health. And with the first responders especially, they're out there on the job regardless. They are exposed at a much higher rate to this virus, and we don't know, is there an end in sight? We don't know. Will there be a vaccine at the very beginning of this, right? Is this us now? This is a permanent situation. First responders already have a 50% higher incident rate of mental illness. So it's 20% in the general population. It's 30% among first responders, just at the baseline without the pandemic, because of the traumatic situations that they're put in, the trauma they're exposed to, the fear of injury on the job. In this case, that's magnified by this ever-present risk of exposure. And as this thing unfolded, we're watching neighbors die, we're watching friends, family pass away. Seemingly, there's no pattern to it. It's indiscriminate. It's a 35-year-old. It's a 65-year-old. It's an 85-year-old. So a huge impact on us. And 2022, we actually saw, unfortunately, the highest number of completed suicides and fatal overdoses that our country has ever seen. We had over 49,000 completed suicides, and we had over 107,000 fatal overdoses in 2022. So what are people doing? They're self-medicating, right? People are afraid to get the care they need. There's already that stigma there about seeking services, right? About seeking mental health services. I don't want folks to think I'm crazy. I should be able to handle this myself, right? Both the external stigma and the internalized stigma. That's already a barrier. But now, why would I want to go to a building with a bunch of other people, right? And risk, increased chances of exposure to this. So folks, the crisis center, we saw our lowest number of people come through. We were right around 2,000. We had been as high as 6,000 people over the course of the year. And I think one of the years there, I think it was 2022 or 21, right around 2,000. So folks weren't seeking the care that they need. Huge impact.
In a time when they probably needed it most.
Exactly right, Ken.
Wow, yeah. Fascinating. I think when you touched on the first responders, that their exposure to higher levels of traumatic experience already, just the nature of their work. Mm-hmm. It's one of the reasons we call them the finest or the bravest, because absolutely. They are every day going out and dealing with, addressing, confronting things that the rest of the population doesn't want to have to deal with. I would venture to say, and correct me if I'm wrong, that the business community also saw that increase in level, because right at the start of COVID, you have business shutdowns, and you have, are you an essential worker or not? And all of a sudden, you've got all these people who they may have invested life savings into getting this enterprise launched, and now there's question about, is it going to survive? Will they be able to keep their doors open? And that stress level goes up. Is that something you saw as well? Did you see an increase in business leaders that might not otherwise have sought services?
Wow, absolutely a huge impact on the business community. I mean, so many businesses were forced to close. We had these massive disruptions to the supply chain. That alone took out a lot of businesses, absolutely. And then, is your business essential or not, right? And every state played this differently. I think in retrospect, we were a lot more open than other states were, right? But, by the end of 2022, we had lost, I think it was about 1 million jobs in this state, right? Just businesses closing, and the stress that puts on not just the business owners but the employees, it's immeasurable. Now we've recovered. It's important to say that we have recovered from this. We've added all the jobs back that we've lost and then some, but still, Ken, this left a mark. It absolutely left a mark. We're social animals, and we're forced to isolate, right? A lot of our communication, the majority of our communication, is nonverbal in nature. What kind of expression do you have on your face while we're talking? But guess what? I can't see half your face now, right? So this left a mark on us. It truly was a traumatic experience for all of us, and some more than others. If you're a first responder that had to deal with this, then that's really a heavy situation, but it did leave a mark on all of us. I feel like we're kind of just starting to heal now that this threat has subsided.
Yeah. As we talk about impact on business community and some of the work that I've done here at the Daytona Regional Chamber, we're in an interesting time with regard to workforce. We've got lower birth rates now by half of what we had post-World War II. So this wave of baby boomers retiring is going to come. We're already going to struggle to find people to fill open jobs. It hadn't occurred to me until we were talking before the before the episode, as in the weeks leading up to this, that mental health is going to play an even more crucial part in business success because employee burnout, all of those things that were common before and prior to 2017, when we had more people looking for work than we had open jobs. If somebody didn't make it, needed to step away, get services, whatever the case might be, there was somebody else who you could hire to bring in and take their place.
You had that backup.
All of a sudden, that's not as likely now because we've got such fewer people. Can you talk about the in the context of mental health and in the workplace, the importance of businesses to be able to make sure that their employees are that they are okay, even if maybe they're putting on a good front for the reasons we've already touched on, but how can the business leaders make sure that their staff, their employees, the folks that are helping their organization succeed, how can we help know that they're okay and getting what they need?
That's a great question, Ken. I'm sure you would agree, our employees are our most valuable resource. They are the heart of our company, the hands of our company, the minds, the mouths. We are nothing without our employees. That's the bottom line, right? And to your point, it's a lot tougher just to replace somebody. But even if you are just replacing somebody, you're caught in this endless cycle of turnover. That's very costly. Do you ever really build a team where there's a true team, where there's a philosophy that everybody embraces? You can't do it if you're just caught in this cycle of perpetual turnover, And what the statistics show is that an individual, an employee that has a mental health illness, if they're not taking care of that, if they're not engaging in recovery, they'll have 5 times the number of unplanned absences over the course of a year. Another really startling statistic that I came across is that over 20% of American workers have admitted to using substances while on the job.
Wow.
And you got to think that's underreporting right there. So at least a fifth. That's frightening. The liability that goes along with that, the risk that goes along with that. We need to be investing in our employees, right? An investment in our employees is truly an investment in not only our businesses, but the health of our community, right? If you've got happy employees, you've got more productive employees, you've got a healthy, happier community that's going out and engaging in the local economy. It's better for everybody. And beyond that, it's the right thing to do. It's the human thing to do. Numbers aside, it's the right thing to do. So, what should an employer do? We just really have to be mindful. We have to keep our eyes peeled and our ears pricked for signs and symptoms of substance use. And that could be something as simple as declining personal hygiene in an employee. So they're coming in a little bit more disheveled than they normally have been, and you see this decline in personal hygiene. That's actually often one of the primary signs, not only for a person developing a substance use disorder, but also for a mental illness, is this decrease in, I just don't care about how I look. I don't have the energy to put it into that, right? Obvious signs for substance use, the person smelling like alcohol, smelling like marijuana, a decrease in performance, right? Absenteeism, again, 5 times more days absent than a person without these conditions, or presenteeism, right? And that's when your employee is there with you, but they're checked out. They're not really there. They're not present mentally, When it comes to mental illnesses, things to look for, talk about hopelessness or helplessness, we have to take those things very seriously. Those are big red flags. Again, absenteeism, or expressing odd ideas, right? Maybe some paranoid ideation. These can all be signs of a person developing a mental illness. And then what do we do in these situations? So it's important that as employers, we're really pushing our EAP, that we're engaging in workplace wellness initiatives, right? So we had a thing at SMA that we did a while back where it was all these little feats of physical strength, which department could plank the most or the longest, and we'd film it and we'd send it into HR, right? Health fairs, those types of things. So really pushing the EAP, pushing workplace initiatives. I think something that can be tough to do, but is so worth the investment of time, is to really carve out time to check in directly with your employees, one-on-one, at least 15 minutes, hopefully more than once a month, to just sit down and talk. How are you doing, right? Just engage with the individual. And if a person is struggling, carving out the time for them, being flexible with what their duties are, what their hours are, to be able to support them in taking care of their mental well-being. That's huge, right?
I want to ask you, because this is, I think where perhaps some people get a little uncomfortable around the subject is and you touched on it a little bit earlier, the idea that I should be able to handle this, or, and it's really, it's not that you're not tough enough to handle it. It's a matter of expertise that a person may or may not have. If you're not mechanically inclined, you wouldn't just guess at how to fix your car. If it breaks down, you're going to take it to somebody who could do that. And I think the same kind of idea exists around mental health. But if you're an employee or if you're a coworker and you start to see some of these signs that kind of give you pause or give you concern, at what point do you know to reach out for help? To not somebody to say, hey, they're just having a bad day, and that's okay. I mean, maybe their kids were really rambunctious in the morning, and it's just kind of set them on the wrong tone. And there's a difference between that and having kind of an ongoing crisis that might be festering. What would you suggest for whether leaders in businesses or just coworkers? If you happen to just be in the same department, what are some of the signs that they look for and go, okay, this is a little different than just a bad day, and we need to make sure they're getting connected with somebody who's got expertise?
Yeah, that's a great question, because we all have bad days. Stuff happens. We're going to be down for a couple of days. We're going to be anxious if we're anticipating something happening to us, to a loved one. So how do we differentiate? That's a really, really good question. And it's all about the frequency, the intensity, and the duration of the symptoms, right? So for depression, I might get down about something, but if that depression is persisting for more than 2 weeks, and it's starting to affect my 3 L's, my ability to live, love, and laugh. That's how I say it. That's the easy way for me to remember it, right? If my depression is now affecting my relationships, my ability to live, my job, right? My ability to enjoy life. If I'm seeing this in somebody else, this depression, maybe the person's withdrawing, you can see sad mood, they're talking less, maybe they're avoiding social interaction. If it's going on for 2 weeks or more, that's an issue. That's definitely an issue, right? When it comes to anxiety, again, we all get anxious. I mean, look what we just went through with this pandemic. I think, it took a while to come down from that anxiety, and some of us still aren't there yet, right? But if that anxiety persists for more than 4 weeks, right, then you're looking at, hey, something's going on here, something more than just coping with life. And it's time to reach out, to your point, to the professionals. And that's what we do. That's what we're here for. We're accessible 24/7, 365. We have a helpline, 1-800-539-4228. That line will also connect a person to our mobile crisis response team. That's a phenomenal service, completely free of charge. We can talk to the individual over the phone. Within an hour's time maximum, we can be at their location. It's an incredible service, and there's absolutely no charge.
That's remarkable, and I'm sure underutilized, as we've talked about some of the data on incidences of this kind of stuff.
We're ready, and we're waiting for those phone calls, and we are all about helping.
So if a business leader is watching this and says, hey, I'm looking for some opportunities, I think we do a good job of taking care of our employees from a benefit side, but maybe this is something we've not really addressed as well, and I'd like to know more about what's out there in terms of what they can offer to their employees. Can share some places they can go, whether it's contacting SMA Healthcare or some resources online that they can get an idea for what are some of the things they can do from an employer standpoint to help support their organization.
Yeah, I think reaching out to SMA is the first step, absolutely. And we are developing a Smart Partners program right now. This is a program where local businesses can partner with SMA. There's different tiers of partnership available. That basically gives you a designated liaison for accessing services. It provides access to custom trainings. There are always the mental health first aid trainings. We do the mental health first aid curriculum. That's something that's been put together by the National Council on Mental Wellbeing. I'm an instructor for that. I've been doing it for over a decade now, and that is a wonderful curriculum. It is evidence-based. It basically has been proven to decrease a person's fear of engaging with an individual who's having these signs and symptoms, and it increases their ability to get that person connected with the help that they need. It's an 8-hour class. We can do it in 2 4-hour parts. There's a nominal fee for the materials, but it's well worth the investment for employers to have their staff trained to keep an eye on each other. Yeah. Absolutely. And the beautiful thing about that training is that it's not just for the workplace, it's for the home, it's for the community. It's anywhere you go, you take these skills with you.
Yeah. Well, Tore, I want to thank you for taking the time to come in and chat with us today to kind of share these resources. It's maybe a little bit that we can do but together as the chamber, as SMA Healthcare, to help spread the word a little bit and overcome that stigma even a little bit more. So thanks for taking the time to come in and talk about this critically important subject today.
Ken, thank you so much for the opportunity. I really do appreciate it.
Yeah. Well, that's going to wrap up another episode of Crest of the Wave. Hope you enjoyed this. Hope you found it valuable. I encourage you, if you have questions, reach out to Tore and his colleagues. They will absolutely answer questions for you and make sure that you're on the right path for either yourself as an individual or your organization. While you're online viewing this, I would encourage you to subscribe and or share the Crest of the Wave. If you subscribe, you'll get notifications every time new content like this is produced and uploaded and shared. We also have sponsorship opportunities available for the program. So if this is something you'd like to connect your organization to and sharing this important information for the business community, reach out to us here at the Daytona Regional Chamber. We'd love to have conversations with you about that. And with that, we'll bring this episode to a close. Tore, thanks again. Thanks to you and all your colleagues at SMA for all the work you do in support of the business community. Really appreciate it.
Thank you, Ken. You're most welcome.
All right. So long, everybody. We'll see you next time. If you enjoyed this podcast, please be sure to subscribe wherever you like to listen to podcasts. For more information on our business community, visit our website at DaytonaChamber.com. Until next time, be ready to catch the next Crest of the Wave.